Good evening. Welcome to Dr. Sam's Pediatrics. I am Dr. S.A. Mahesh Khanna. I am a consultant pediatrician in MNP Clinic. I also work as senior resident in Department of Pediatrics, Swami Vivekananda Medical College Hospital, Tiruchengodu. Today we are going to discuss an interesting topic, which is Centor scoring or a McIsaac scoring. This Centor scoring or McIsaac scoring is used to differentiate a viral pharyngitis from a streptococcal pharyngitis. Let's go on to the score. It has totally 5 components. The first component is temperature more than 100.4. If a baby comes to your clinic and you have any difficulties while assessing whether this is a viral sore throat or a streptococcal pharyngitis, this score will be useful. And if the temperature is more than 100.4, give 1 point to the score. And if there is no cough, please make a note, if there is no cough, then only you give 1 point, because presence of cough is usually an indicator of a viral infection. And third point, it is painful, swollen anterior cervical lymph node. Should be both. It should be enlarged and it should be tender. And it is specifically the anterior cervical node, so it's not the posterior ones. So if you have this criteria, you give 1 point. And you just examine the throat and you see a tonsillar swelling or an exudate. If it is present, then give 1 more score. And if the age is between 3 to 14 years, you give a score of 1. So if you observe, all the 5 criteria does not need any lab work. So it is a simple bedside score. So you just give the score, and now you are going to give a total score out of 5. So if you have a baby who just have a score of 1 or 2 out of 5, so this is one end of the spectrum. So in this case, it is usually a viral cause causing the pharyngitis. So you no need to treat this baby with any antibiotics. You just give a symptomatic relief with paracetamol or antihistaminics and observe the baby. So this is for this. If you have a score which is 4 or 5 out of 5, this is the higher end of the spectrum, and the likelihood of streptococcal pharyngitis is much more. So in this case, you treat the baby with empirical antibiotics, or more preferably, if you are having a facility to do a rapid antigen testing for streptococcal pharyngitis, you do it. And then if it turns out to be positive, you will start on antibiotics. But 4 or 5 out of 5 warrants empirical antibiotic therapy. If you are in the midway, where the score is 3 out of 5, it is usually the clinician's decision whether to start an antibiotic or not. And if you have the facility of rapid antigen test, it is better to do the rapid antigen test. The rapid antigen test just has a turnaround time of less than 15 to 20 minutes. So if you have the facility, do it, and if it turns out to be positive, start on antibiotics. If you don't have a facility, then directly you can start antibiotics or not. That is up to your decision. So this is a simple bedside tool to whether to start the baby on antibiotics or not if the baby comes for fever and sore throat to your clinic. Hope you find this helpful. Thank you.